When was the last time you explored your relationship with alcohol? Moderation programs offer an alternative to traditional approaches by encouraging individuals to reduce or quit alcohol use and promoting healthier behaviors without any judgment. Welcome to Normalize the Conversation. I'm your host, Francesca Regater, and today I'm joined by the co-founder and CEO at Oar Health, Jonathan Hunt-Glassman. In this episode, we delve into the concept of moderation and medication-assisted treatment as alternative paths toward overcoming alcohol misuse. Join us as we discuss the potential benefits and considerations of these methods, providing insights into navigating the journey towards a healthier relationship with alcohol. Jonathan, thank you so much for joining me today. I am super excited to talk with you. But before we begin, I just want to check in. How are you really?
Well, I have the day-to-day concerns, even anxieties of an entrepreneur and operator of a small business. But beneath that, feel a pretty healthy reservoir of purpose, since I do work for a purpose-driven company, and a lot of confidence and comfort in kind of the most important relationships in my life with my wife, with my close friends.
I really resonate with that. I think having a small business, a lot of people don't understand how much pressure and stress and anxiety really goes into it because there is a lot and you're figuring it out as you go. And when it's so passion driven, at least for me, when it's so passion driven, you just want people to get that passion too. You want them to feel it and feel that purpose. So that really sums up how I feel. So thank you for that. I never have the words to describe it so eloquently.
At least we're in the same boat.
Right? I love that. In this together. But tell us about your organization, Oar Health.
Sure. So Oar Health is a telemedicine platform that helps people who are trying to drink less or quit get access to safe, effective medication that can be a helpful tool to accomplish that goal. So we help people connect with a medical professional licensed in their state who can evaluate whether medication is right for them. And then in many cases, ship that medication directly to our members so that they can get started building a better relationship with alcohol.
That sounds like it really helps increase access to medication-assisted treatment, to treatment in general. A lot of people, it's not easy to find a licensed mental health professional. It's not necessarily easy to have the time to be able to go in person. It's not necessarily easy to get that prescription for the medication. So to see that you're really kind of breaking down those barriers is incredible.
Thank you. The statistics are kind of stunning in this regard. There are 30 million Americans who meet the diagnostic criteria for alcohol use disorder. Less than 10% get treatment of any sort. So that includes mutual peer support meetings, therapy, anything. And less than 3% prescribed any sort of medication to help them with their condition, despite the widespread availability of several medications that can be helpful to people.
It's really heartbreaking to see how many people are struggling and how many people just don't have the help that they need. I really appreciate what you're doing, and I'm excited to learn more about what inspired you to start Oar Health.
I came to it very personally. I spent my whole career in healthcare, but in parallel to that, struggled with alcohol misuse my entire adult life. What started as binge drinking in high school and college became a pattern of drinking to blackout in my 20s. And then as I saw peers put that sort of excessive alcohol use behind them, grow up, you could call it, the opposite was happening for me. I was having multi-day binges, experiencing the physical and mental health symptoms of withdrawal from alcohol on the back end of those. And so in a pretty rough spot. And over those 15 years or so, it was no secret to me that I had a drinking problem. So I sought help in a lot of places, pretty much always hearing you need to quit cold turkey and start going to AA meetings. I gave that a shot, but it didn't really fit me. What was much more of a turning point for me was connecting with a physician who accepted my goal of moderation rather than abstinence and suggested prescription medication as a tool in the toolkit. Pretty transformational for me, but also prompted some questions and some research about why it had taken me so long to find this solution, despite being such a privileged, informed healthcare consumer, and how common my experience was. Unfortunately, or fortunately, depending on how you want to look at it, it didn't take too much research to confirm that I was far from alone in having the sort of access problems that you were describing.
You brought up so many amazing points. Thank you for sharing your journey with us, by the way. I I think it's really common. I'm in my 20s, and there's that kind of line you're walking between drinking and having fun with your friends and being in your early 20s and relying on it, drinking too much to a point where it's impacting your functionality and just your ability to really get to grow and do things. So I love that you talked about misuse and talked about how, it was blocking out, but then it's everyone else is starting to grow out of it and you're realizing, "Hey, I'm not there." I think that's really important because a lot of people are like, "Well, that's normal. I'm in college. I'm supposed to be having fun." So where would you say is that going more in detail into where that line is between I'm having fun and I am maybe misusing alcohol and could benefit from some kind of support?
It's a great question. One of the things that we try to do at OR and I try to do is steer away from false binaries. And one of the biggest ones is we have alcoholics and people have no issue with alcohol whatsoever. The reality is there are a lot of us who are somewhere on that spectrum you just described of trying to figure out a better relationship with alcohol. Many people will grow into that better relationship. Some can develop that better relationship just with commercially available products like low and no ABV cocktails, which are having a moment of growth. And then there are some of us who need treatment. The diagnostic criteria for alcohol use disorder is a pretty good place to start. That is defined as being unable to stop or control drinking despite harmful health, social, professional consequences. And so there are a couple really important nuggets in there. Have you tried to cut back or quit and been unsuccessful? Are you seeing negative consequences in your most important relationships, in your obligations, either at work or in your community? If that's the pattern that's cropping up, then that's cause for concern.
That's a really great way to frame it. I love how you said it doesn't have to be just alcoholics and no issue with alcohol because it is a continuum, it's a spectrum. And you might not have a diagnosis, but you may be able to benefit from forming a better relationship. You may be able to benefit from understanding, hey, this is maybe too much on a daily basis or on a weekly basis. Let me practice more mindful ways to consume alcohol. Not to say that you have to go either abstinence or keep drinking, but being more mindful in how much you're taking and, like you said, moderation.
Yeah, I think it's a really positive trend that goes beyond just the treatment of alcohol use disorder, this notion of mindful drinking. The reality is, alcohol has been consumed by humans for all of recorded history. It's not going away. Many are able to use it responsibly and in a way that it's a helpful social technology or relaxant without the consequences outweighing the benefits. And so I think almost anyone can benefit from kind of a check-in. And then there'll be all sorts of outcomes from that. There are those who say, this is working for me. There'll be those who say, I want to make an adjustment just on my own. And then there are those who say, I want some help. Where I've tried to focus what we do at Oar Health is kind of on that segment of folks who feel like I need some help, but for whatever reason, the traditional options that we're most familiar with, Alcoholics Anonymous, inpatient rehabilitation, don't make sense either, or don't feel like a great fit, either because of philosophy, convenience, cost. We need some options all across the spectrum. Those who need formal treatment need options. Those who don't need formal treatment, and then within the formal treatment bucket, it doesn't always have to be 90 meetings in 90 days or 28 days in a facility.
Yeah, there's so many more options out there and not enough conversation about it. I am doing my master's in clinical psychology right now. And last semester, I took the substance use course. And that was the first time I heard about moderation and not just abstinence. And the teacher talks about how it's different in every setting and for each person, which approach. A lot of therapists and counselors may say, nope, it's only abstinence. And a lot may say, no, moderation is a great one. So it's about finding not just the figuring out the approach yourself, but finding someone who's willing to have that conversation with you. Maybe you don't know what the route for you to take is, or you tried AA, didn't seem like that was the right fit for you, and you feel kind of stuck. Finding counselors, finding therapists, finding other people who've maybe struggled, podcast episodes like this, conversations to figure out what other options are out there. It's not just AA and rehab, which a lot of people think are the only two options. And when those don't work the best or don't feel like the best fit or feel like you don't fit in, a lot of people just think, I can't get help. There's nothing for me.
Yeah, this is not a one size fits all solution. And I think one of the most important messages, both for professionals and those who are struggling individually, is that the menu of evidence based treatment options is broader and more diverse than we may realize just from what's depicted on TV or what we've picked up upon. There are a few different categories of evidence-based help. Professional behavioral health care, such as seeing a therapist, is an important one. Mutual peer support is effective if AA doesn't feel like the right fit. There are other groups like moderation management that's specifically focused on people who have the goal of moderation, and smart recovery, which is abstinence oriented, but secular and evidence based in its facilitation approach. And then, of course, there's the category of what we do at Oar Health, which is effective, safe, FDA approved medications for alcohol problems. And the great part about that menu is that pretty much everything on it is complementary rather than competitive. And so I'm a big believer that every individual who's struggling with alcohol or other substance use disorders or just other addictive behaviors in general should really feel empowered to assemble the toolkit that fits them. You don't have to become an expert on every modality under the sun, but it pays to do some research and expand your option set until you're feeling kind of a good gut instinct that, yeah, this feels like it might be a fit for me. This resonates with how I've solved other tough problems in the past. And then none of those commitments are final. You can always adjust that toolkit, do more of what's working, do less of what's not, and ramp up the intensity or ramp down the intensity over time, since these are often issues that ebb and peak in terms of how challenging they are.
Yes, finding what works for you is essential. When it comes to behavioral health or substance use treatment, people tend to think I have to do what works for other people, right? They think it is this one size fits all and medication worked for this person, rehab worked for this person, inpatient worked for this person. Thus, it has to work for me. And when it doesn't, it feels very defeating. So knowing that it's about you and what works for you based on your lifestyle, based on your budget, based on how you feel, based on things you enjoy, what makes you feel strong, what makes you feel good, what makes you feel accountable. All of these things are going to impact what works for you. And knowing that that's okay. It doesn't have to be the same as your friend who maybe went through the same thing.
I'll go a step further and say that, even those of us in the helping business, as you and I aspire to be, can sometimes fall into this same trap of thinking whatever worked for us is going to work for everybody. And that's something that I've tried to avoid as a founder in this space. We have to start somewhere as a small company, and we've focused on increasing access to medication. But I would never try to say that that's a one size fits all answer. It's probably worth trying for most people who are trying to drink less or quit, but it's not going to be the end all and the be all end all be all for everybody. I think you also, I just want to return to a point that you made earlier that I think is so important, which is different professionals and different helping organizations are going to have their different philosophies. And so, given how challenging this problem can be, and given what a diversity of approaches that are out there, it's so important to not give up after one or two approaches that didn't feel quite right for you. Um, there are other providers out there who may be a better fit. We see that at Oar. I think in particular of a member who said that she screwed up the courage to, tell her primary care provider about her alcohol problem. And he kind of brushed it off, which is not great. But to her credit, she didn't stop there and she didn't let that discourage her. She turned to the internet and the tools of telemedicine to find a better fit, which ended up being a prescriber on the Oar platform. So that's just one example of how this problem does take some stick-to-itiveness often to find the right fit, but it is so worth it.
Yes, you really have to be persistent. And a lot of times, the first treatment option you find might not be the best one for you, might not be the best fit. It might not even be the treatment approach. It could be the counselor, it could be the person helping you, the provider. It could, maybe it's not the provider, but it's a different, wrong treatment approach for you. So knowing that those kind of go hand in hand and it's okay if it's not the right fit. But I am curious because you brought it up, how does someone maybe know like this is just something that's outside my comfort zone and it's new, and the difference between that and this is just not the right fit for me, I need to try something else?
It's a terrific question. I'm curious your perspective on that as you are going through your training and beginning to build your practice. I think there are a couple of questions. My very first job was a consumer feedback tool used in behavioral healthcare settings. And so we spent a lot of time thinking about helping consumers and providers of behavioral healthcare think about how do we evaluate fit. And I think some of the questions that were most helpful and also validated as predictors of long-term treatment outcomes were, are we making early progress? That's a totally fair question to ask. And it is a predictor of long-term outcomes. Are we working on the goals that are important to me? It's perfectly appropriate for healthcare professionals to have goals for their patients, but in these complex change projects, the patient or client is probably going to do 50 to 90% of the work. So their goals are pretty important too. Do I feel like the provider gets me? And that's no negative judgment on the provider if they don't. They're just as in any sort of relationship you can imagine. There's chemistry and the absence of chemistry. There's connection and the ability to communicate on the same wavelength, or there's not. I think you make a good point that a little bit of discomfort is not a reason to abandon treatment. It kind of goes with the territory. I would try and focus on those 2, 3, 4 important questions to you. Are we making progress? Are we making progress towards the right goals? Does this clinician or provider feel like the right fit for me? But what would you say? I'm curious what your answer would be.
My answers would be right along that same path. One would be, what are the goals? What does the therapist see the goals as? And what does the client see the goals as? And looking at them together and asking the therapist, hey, not only what are our goals, but how do we plan to get there? What's your role in it? Because if a therapist is using a very direct focus on the present approach, and you really need to go on healing the past and hitting the root of the trauma and what's caused this kind of behavior, you might not benefit from a therapist that's only focused on the present. So being able to understand their modalities, I think it's really helpful, and having them explain it in words that make sense. Because if someone says, I follow Gestalt theory, it might be difficult if you don't know what that is. I'm learning what that is. And I feel overwhelmed when my teachers use this big language. So really asking what those goals are and how they plan to support you on those goals, because it could be the right goal, but the wrong approach. That's a big one. Another one I'd say is, yeah, is the therapist the right fit for you? Do they understand where you're coming from and willing to meet you where you are? Because if you have a therapist who loves a very direct, hands-on approach and is going to call you out and you're not someone who can be called out in that way, it's okay, but that might not be the great best fit for you. So am I uncomfortable because this is something new, or am I uncomfortable because I feel like I'm being, I don't wanna say yelled at or attacked, but put on the spot in a way that's not right for me. I love
Mhm,
to be called out, but I don't like being told what to do. So you
mhm.
can tell me that my behavior is not helpful for me, but if you tell me exactly what behavior to do, I'm not gonna respond well. I don't like to be told what to do. So finding what, not just the right fit and understanding you, but are they willing to work where you are and what you need? Those would be my big 2.
Makes sense to me. I've benefited tremendously from psychotherapy as a client in my life, and the most effective therapist that I worked with was able to kind of meet me on kind of my preferred way of processing the world, which is pretty logical, rational, verbally driven, and establish credibility that he was just as smart at seeing the world that way, and at the same time nudge me, push me towards experiencing the world and getting in touch with the more emotional and physical reactions. And, that was the right combination for me. I think if I'd had a therapist who just went straight to, I don't care what your hyper rational thoughts or explanations are, I just want the experiential, never would have gotten over the barrier. And so, that's just one individual's experience. We all bring our own ways of processing the world and expectations for the partner in the change project. But it certainly resonates with the factors you were describing.
Yeah, I have a very similar experience. I have extreme test anxiety. I've gotten a lot better, but I used to get, like, physically sick and wouldn't be able to sleep for weeks coming up to exams. And I had one therapist who was like, "You need to just calm down. You need to just calm down and not get stressed out. You always do fine." And I'm like, "Great." That gave me no tools or direction or anything to, like, help myself not do what you just told me not to. That doesn't help me. I'm the kind of person who needs, what can I do to help me get through it and manage it? Right? I need a guide. You can tell me, like, you don't need to freak out, you don't need to panic, but tell me to just stop that behavior wasn't helpful. But I had one person who was like, okay, what can you do during the day leading up to the exam that can maybe help you catch your breath? So I would
Mhm.
schedule in 20 minutes to go for a walk, or 5 minutes for breathing exercise, or going to pick up my cousins from school just to get out of the house for a little bit and force myself to relax. So finding someone who's willing to meet you where you are and help you find those tools to take those steps, I know for me is very helpful. But I have friends who are like, call me out, be direct, tell me what to do, and I'll do it. We had an argument in class last night actually with our teacher on advice. Do you tell the client what to do or do you not tell them? And a lot of people like the tell them approach. I'm like, I like the guide them approach. What can you do? And give them the chance to figure it out. But it's different for each person. And knowing that these are questions you can ask your therapist really helps you find one that's right for you.
Yeah, totally. I am not a licensed therapist or a healthcare professional in any way, but have had the chance to interact with a lot of our members in our mutual peer support group, where we've kind of tried to navigate the same issues. And while there's of course individual um, difference in what style advice guiding that people prefer, um, certainly what I've observed is that the more agency the individual can feel in setting goals, developing strategies to achieve them, measuring progress towards them, the more their inherent strengths as a person are activated, the more they're able to tap into resources in their families and communities. And so I've kind of migrated very much towards a guiding approach to kind of, again, kind of, one of my earliest mentors in this business was a therapist himself, and he really impressed upon me that whether someone's coming to your office for an hour or participating in a mutual peer support meeting for an hour, that still leaves 23 hours a day when they're going to be working on whatever their change project is in their own lives. So the more that they can leave the room, virtual or physical, with energy to throw at the problem, those other 23 hours a day, the more the overall odds of success. And that can be, a little awkward for those of us in the helping business, because maybe we're kind of in the background of the change project. But I think that's okay. Of course, we have a role to play in offering advice based on expertise and experience. But I really think it's got to be tailored to the individual in question and geared towards activating their inherent strengths and the resources they can rally around them.
Absolutely. Every single person's different. What they need is different. And being able to listen to them, being able to find someone who's willing to listen to you is huge. I'm actually really curious. In the beginning of your journey, when you first started to reach out for help, what did you notice kind of helped you? Because like you said, the other 23 hours a day, you're kind of on your own figuring it out. So what really helped you get through those other 23 hours? How long did it take to be able to start getting through those 23 hours with changed behavior?
Yeah. So after I was, prescribed medication to help with my problem, it sat on my shelf for about a month. And so what was really helpful in actually getting started with the prescribed treatment was taking a little bit of a curious rather than judgmental perspective. What I ultimately, my internal monologue that ultimately got me over the hump was, let's treat this as an experiment. I'm going to take this medication, see how it goes if I have a drink. Hopefully it helps. And if it doesn't, I'm no worse off than I was before. So let's see what happens. Sometimes that kind of less judgmental approach can be helpful. The second thing that I kind of found helpful outside the doctor's office was forming my own mindful plan to drink less. And given that my goal was moderation rather than sobriety, I spent a lot of time thinking about, what does that mean? That can be a much slipperier goal. And so for me, I set the bright line of no blackouts, because that was something that was measurable and quite meaningful to me, because that was what was associated with all of my most negative experiences with alcohol. For others, it's a specific quantity or other metric, but a clear goal helps. And then lastly, specific strategies. And some of these got down to the very tactical level. I just decided no shots, no more than one drink before eating something. That was just based on thinking about good experiences with alcohol, bad experiences with alcohol. And then lastly, the last part of the plan was enlisting, someone close to me, in my case, my wife, in kind of high risk situations where the social cues are to keep drinking, to just be a little bit of a monitor and to kind of let me know if she saw me, what she of course recognized as kind of entering that danger zone, so to speak. And so those specifics will vary a lot individual to individual, but I think kind of a curious mindset, a plan, clear goals, strategies to achieve it, support where it's available are probably good components to think about.
Having those goals that are measurable is really helpful because you can see the progress. I think for me, the biggest thing that comes up in any kind of treatment is, can I see the progress? If I feel like I can't see it, I get very anxious. I'm like, am I making progress? I have one of those brains that'll tell me, you're not doing enough. You're not doing a good enough job. So being able to actually track it can be very helpful. And I love that you had that support within your wife to kind of be there for you, because the support system is huge. But the thing that I love the most you said is that kind of thought reframing and shifting to talk to yourself with more kindness, because we are naturally a lot more judgmental to ourselves. Self-criticism is something we all struggle with. That inner voice is often a critic. So being able to switch it from you this negative tone, this judgmental tone, making you feel bad in every moment, to let's try it. Let's see what happens. Encouraging yourself through it. can really be the difference between whether or not you take that first step.
Absolutely. And I think opens the door to what you described about noticing progress early on. As I think about the members at Oar, sometimes those first signs of progress are minuscule, but it's so helpful to kind of define and notice even that smallest step. Just the other day, a member was saying that her first noticeable sign of progress was she had driven home without stopping to buy alcohol. And there was one change in her afternoon, but often noticing just that one change can kind of build the confidence and create this, really positive chain reaction. Whether the progress is specific to the substance misuse, as it was in this case, or in other forms of life. I went for a run today because I wasn't drinking after work. That's progress too. And what a lot of our members find is like it goes slow, 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 and then before they know it, they're in a setting where that would have been hugely problematic in the past. They look around 2 or 3 hours into it and they're not drunk, and they're almost surprised because the slow progress added up so quickly.
Slow progress really adds up step by step. You get through that up that staircase. It's amazing. I was wondering, I know it's very different for every person, but could you maybe walk us through if someone's listening to this and they're like, maybe I want to reach out to Oar Health and see if they can help me, what that process maybe looks like?
Sure. So our North Star is making access to medication that can help people drink less or quit as accessible as possible. So that translates to a few things in the experience. People are invited to go to Oar Health, OAR health.com. We have some content and resources that aims to explain alcohol use disorder and medication assisted treatment. If those are new concepts to you, you're far from alone. And then if they do end up being something that someone is interested in, they can start a virtual consultation with a clinician right from our website. And so we ask questions about alcohol use and its patterns. We take a general health history and medication list to determine if treatment with medication is going to be safe and appropriate. And then we do need to verify people's identity, typically with a driver's license and a selfie. That all gets batched up, goes to a clinician licensed in the member state. There's communication back and forth. And the end goal of that is for the clinician to put together a treatment plan, which will likely include psychosocial resources based on what the individual is interested in, and where appropriate, a prescription for naltrexone, which is the recommended frontline medication for treating alcohol use disorder. At the member's choice, we can ship that to them directly. Usually gets to their house in a few days, and folks are, often taking that first meaningful step, in far less than a week from their first visit to Oar Health.
That is amazing. A lot of people, wait times can be so long. A lot of people have to wait. For me to even get a therapist, I just started with a new therapist on Monday. It took me 7 or 8 months on a wait list to even get a therapist. I was like, what if I'm in crisis? Right? What if I need support right now? It can be very difficult to access immediate support. I mean, there is 988 if anyone's struggling. There are options, but it can be very long wait time to actually start getting effective help and having actual treatment goals and someone there alongside you. So to see that someone can go on the website today and within a week possibly be starting to make progress is incredible.
That's very much the goal. Kind of the issue of wait times is also very true in the small subspecialty of addiction medicine. There are only a few thousand psychiatrists who focus on addiction, plus MDs who are trained and licensed in addiction medicine. And so, we need to increase access to their expertise. The good news is that the medications that are used to treat alcohol use disorder have been around for decades. They're safe, they're effective. If you talk to the NIAAA, part of the NIH, they would say Yeah, these medications are dramatically underprescribed relative to the need. They're no more complex to prescribe than an antidepressant, for example. They're appropriate to prescribe across different settings. It doesn't need to be a specialty addiction treatment program. It could be a primary care office. It could be the emergency department, given how many admissions there are alcohol related. It could be telehealth. And so that's kind of the call that we're aiming to answer. Is we've kind of known these medications work for 30 years. There's been journal article after journal article saying, let's prescribe more of them. We said, okay, we're going to do that.
That is incredible. It really helps so many people get help when they need it.
I mean, that's just a feature of this problem as well, right? It's like, it's hard to predict when the moment is when someone's going to summon up the motivation to address this big challenge, and we want to be there in that moment, even if it's 2 a.m.
Yeah, when you finally get the courage to reach out for help, it's terrible to have to wait so long to get an answer, to get a response, to get that feeling of support, like you're not in this alone and you don't have to go through this alone. I think this is absolutely incredible. And as we're wrapping up, let's say someone out there is deciding to reach out for help. What's a piece of encouragement you can offer them?
Say three things. Recovery is possible. I'm one example of that, but there are millions of others who have recovered from alcohol or drug addiction. Two, the treatment options are more numerous and varied than you may expect. So it pays to do some research and find an option that seems like it might fit you well. And then lastly, it's never too early or too late to start getting better. You don't have to wait for rock bottom. But on the other side of that coin, no matter how dark and difficult things feel at the moment, it's always possible to have a brighter and better tomorrow.
Thank you so much for listening to Normalize the Conversation. Don't forget to subscribe, rate, and review. This podcast is an initiative of Inspiring My Generation, focusing on normalizing the conversation, bringing education and awareness to the forefront, and amplifying global voices to spark change and hope. Inspiring My Generation is a 501c3 nonprofit organization on a mission towards suicide prevention through awareness, conversation, education, and support. Connect with us on Instagram at Inspiring My Generation and visit our website inspiringmygeneration.org to learn more about our work and how you can make a difference.